All right, now what we're discussing is, certain health issues for individuals who are fit, who are taking care of their health. But is it mental stress? Is this too much of excess? What is the reason why when you hear folks like, Mr. Kamath going through a stroke-like situation? So what should one be doing? Why are we discussing this? Well, in stock markets, when it comes to trading, when it comes to mental stress, when it comes to dealing with situation, well, we need a lot of guidance. Dr. Pratit Samdani, internal physician and intensive care specialist with Breach Candy joins us now. Where is Dr. Samdani? I have seen him earlier. He looks different. This is somebody else's twin clone or something.
No,
is that you,
thank
Dr.
you,
Samdani?
Medical science is still not advanced. You can clone someone so fast, but no sooner than later for sure.
Voice which is making me feel that this is Dr. Pratit Samdani. The appearance is looking very, very different.
Thank you. Hope you all are doing well. Always great to see you and be on your show.
You surprised me today. Okay, we are discussing an individual here, not an individual here, but what we are discussing perhaps is a larger concern which seems to be there, at least when folks 40 plus who are fit, don't have bad lifestyles, don't have any pre-ailments, don't have basic issues, but when they suffer cardiac arrests, brain stroke, why is that happening? That number is increasing, and especially when it comes to our viewers, the trading community in stock market, there's stress always.
That's true. Globally, the incidence of stroke is very, very high, almost 8 to 100 per million. That's the data that we have. Especially when I talk about this percentage, it's in people who are less than 45 years of age. Once, if your age advances, certainly the risk of stroke increases. And really the essential, most important causes of stroke are diabetes, hypertension, uncontrolled cholesterol levels, bad family history, hurry, worry, and curry. So bad food, rushing for work, and of course, a lot of stress and anxiety. People who do exercise, as you said, Nikunj, also get stroke, and that's true. There are many variable and invariable factors, or some what I call as modifiable and unmodifiable. One of the modifiable factors is all the ones that I've said. The unmodifiable factors, unfortunately, is age, a very strong family history. So I think we must focus ourselves on the modifiable factors, and stroke to a large extent can be prevented. Control of sugar, control of weight, control of eating habits, a good healthy lifestyle, not to overdo too much of exercises, do adequate, sleep well, control your stress when you're doing trading, especially for the viewers on your channel. Just don't carry on the trade back home in terms of mental stress. Finish the trade and get back to life and healthy lifestyle.
Fact of the matter is that things are easier said than done. I mean, we live in never switch off, times. Even when you're home, you're always wired in. And, more so in young promoters, one is seeing who are always on the go, always traveling, always on call, and extremely fit as well with not much, ailment history in their families. Even they are now getting susceptible to strokes and heart attacks.
That's absolutely true. And the real reason, I think, is lack of sleep, excessive stress, excessive alcohol, cigarette smoking, tobacco, inhalation, orally are 100% modifiable risk factors. I think the zeal and the zest to make money and prove yourself in this competitive world puts one to an increased risk of stroke and heart diseases. So this, I think we must spend time for ourselves. If you're alive today, we'll be able to help the community tomorrow. We'll be able to be with the family tomorrow and do much more work. As often say, in a matter of joke, I tell people, the thinner you are, actually will eat more because you live longer.
Can the heart stroke, can there be early detection by doing regular health checkups in case your body has issues when it comes to stroke or a heart attack? Can that be detected by simple regular health checkups?
A very, very pertinent and great question. So cardiac diseases, when I talk about cardiac diseases, it typically means hypertension, it means heart failure, of course it means heart attack, and it means something called as cardiomyopathy or low function of the heart can easily be detected on regular checkup. Every day, we find several people who are as fit as a fiddle come in with reports that are not as good as they want them to be, following a great lifestyle, etc. So health checkup may include, in terms of cardiac perspective, an EKG or an ECG, an echocardiogram, and a stress test. For the high risk individual, for a patient, for a family member who has a very strong history of heart disease, there's more often than not that I do advise them to get a CT coronary angio, which is a screening test to see the vessels of the heart, the arteries of the heart. It's not a gold standard, but I think it has a great negative predictive value. That means if your CT coronary is normal, the chance of you getting a heart attack is much, much less. So it can be prevented. When it comes to stroke, measuring sugars below 7% glycosylated hemoglobin, acting to treat not only with medications, lifestyle remains the most important thing. When your sugar crosses between 5.8 and 6.5, and that's what I call the pre-diabetes phase, is very, very important. This is something that's reversible at this stage. One clinical test that I often say that, like we've learned, the people have learned that there is something called as the golden hour for heart attacks. You need to get to the hospital, get what is required, whether it's an angiography or medication to treat your clot busting. I want the stroke patients to realize something at home. There is act fast. And when I say fast, it comes with an acronym. Fast, as in if you see a facial deviation on one side, if you have difficulty lifting your arms, if you have a speech problem, if you're stuttering, muttering, missing words, and act quickly because time is the essence. So remember fast for people at home, facial deviation or asymmetry of the face, problem in lifting your arm, one hand may not go up. If you have a speech problem, dysarthria, you can't gather sentences, can't speak words completely, and of course, time, rush to the closest hospital.
You talked about hurry, worry, and curry. I will not be fast and I will take the liberty of asking one more question. The audience or our audience at ET now is pretty much aware of the ills of smoking, how excess alcohol consumption could impact your body. Some of them do their regular 30 minutes on their treadmill, they do their stretching, some of them have started meditation. Do you think a perfectly good lifestyle is good enough to take care of aging problems, or regular heart checkups and body checkups are imperative irrespective of a healthy lifestyle?
The healthier you are, the less likely that you're having modifiable risk factors that are at a higher risk. However, I must tell you that regular health checkup picks up lots of much more things, even if you have no hurry, if you're not worried, or if you're not eating that curry. Regular health checkups can mitigate and reduce the risk. So I think these tests are so simple, they're easy, they're conclusive, and they can lead you to a good, healthier lifestyle in future. So, Nikunj, I would say that you must do a regular health checkup, especially for the elderly and or people who have a family history of what I call as atherosclerotic cardiovascular diseases or atherosclerotic diseases.
got a SMS saying that वो सब तो ठीक है, समदानी साहब से पूछो hair का secret क्या है?
Hair ka secret है that you just said anti-aging, reduce your, you want to live longer, you want to look younger, and that's the secret.
Hair will make me fitter? Is that what you're saying?
No, hair will not make you fitter, it'll make you aesthetically fitter.
Well, so nice to have you back, and I'm so glad we are discussing for a change not COVID and what all happened to the world in 2021. We are discussing what could be important but preventive, crucial but useful in terms of a lifestyle change.
I'm very happy to be on a new high with your market soaring higher. Thank you so much, Nikunj. Thank you.